Hi, Flo. How are you?
Hi, Christy. I am so happy to be here.
We're so happy to have you and to learn more about your wellness initiative. But first, can you tell us a little bit about yourself and what led you to your role at PCOM?
Sure. So in my tenure before I went to college, I worked as support staff at a hospital as a nursing assistant and a unit secretary. So I knew I had a desire to want to help people, but it just was not supposed to be inside of the hospital walls. So I went to school for public health and communications, graduated with a dual degree from Temple University, and went back for my degree in health communications for my graduate degree. And I started working in a community health educator, injury prevention coordinator, manager of community health outreach. But most of that was within the health system. So when the opportunity came up to still work with the community, but work with future clinicians to help them get into the community to see people as people first, but for patients, I had to do it. It was just exciting to move from a clinical setting to a college, but still have the desire and the opportunity to work in the community.
That's wonderful. It seems like it's very aligned for you, that this is where you were meant to be.
I know, I really feel that way. It is my passion. And, it's exciting to do something that you love.
It's powerful to do something that you love. I think when we really bring our passion to a job, we're more effective at that role, right? Because you're showing up every day excited to do what you're doing.
Exactly. You're like showing up, bringing joy.
Yes.
Bringing joy to as many moments as you can.
I love that. And the fact that you're working with the community, there's no better way to show up than with joy and to be excited to serve. So you're the director of PCOM's Community Wellness Initiative. Can you tell us more about what this initiative is and what it aims to achieve?
Absolutely. The Community Wellness Initiative started in 2021. This was a response to COVID. Our students were helping with vaccinations, and the president, Dr. J. Feldstein, said, hey, we would like to see our students do more than just vaccines. And how can we provide an intentional opportunity to have them out doing health screenings, direct patient care, education, community-based research? So it was launched in 2021. We decided to grow a mission and have a vision statement to be more intentional about caring for our community members that surround each campus and our healthcare center. And that goes into what our desire is. How can we help them have an overall sense of well-being in their life, mentally, physically, emotionally, spiritually? And the community wellness, we get our students and our faculty members to volunteer and provide those services.
That's great. And it's very nice to hear that it was something positive that came out of that time of, everything that was going on with COVID, and that your students were able to be out there in the community, but then that inspired more, to be done within the community by the students.
Absolutely.
So the initiative includes patient care activities such as health screenings, vaccines, and mammograms. Can you tell us more about how PCOM is working to bring these important activities into the community?
So the best way that we do this is through partnerships, right? We collaborate with community-based organizations, churches, senior residential apartment complexes, but we collaborate with health systems, other healthcare organizations, and schools that are doing the work. So we make sure that the opportunity is available, but then we partner with these community-based organizations because there's a nice saying in public health that says, it can't be about me without me, right? So trying to do work in the community without the community's voice, without the community-based organizations, it seems irrelevant and you won't get a good response. So we really do leverage the opportunity of partnerships to get the work done.
That's great. And that makes a lot of sense.
Yeah.
To make it, the greatest impact that you can make in the community, to get partners and other people involved. And can you tell us about how the Community Wellness Initiative supports research, including clinical or community-based, and how the PCOM students and faculties are involved in that research?
Absolutely. So one thing that's really unique about the Community Wellness Initiative, and we also refer to this as CWI. So I'll say CWI going forward probably. We have an opportunity for students and faculty to apply for funding. So they apply for funding based on the project of research that they want to do. And this allows for us to support their project, to buy the supplies, to do the research in the community, because sometimes smaller research projects, they're not noticed on a larger level if you're trying to get government funding. So this allows us to do those more smaller, intentional community-based research, and it's usually from the students and the staff applying for that funding. And so CWI will fund it. But also, we also have that opportunity again to leverage our partnerships. So let's say a faculty member wants to do some type of research around blood pressure in the community, but they don't know the community. We then have the opportunity to say, let me see if this residential complex will be willing, so we can connect them to the community partner as well. So 2 ways: we fund, and then we leverage the partnership and make the connection too.
To make it all happen.
Mm-hmm.
So I want to take a step back, because I think it's important probably that we explain what PCOM is, right? I should have asked you that in the beginning, but I'm just thinking as somebody that's listening that might not entirely be aware, and the campuses that you have, so that we get a better idea of who actually is involved in this work in terms of the student population.
Absolutely. That's a good thing. So PCOM is the Philadelphia College of Osteopathic Medicine. We have 3 campuses, one in Pennsylvania and Philly, right off of City Line Avenue. We have a campus in Georgia, North Georgia, so that's in our Swanee area, and it's more of a suburban area. And then we have our newest campus in South Georgia, which is in Moultrie, and that is really more of a country area, right? So it's very rural. It's a rural college campus. And so what's interesting about how CWI connects with each campus, and I should say that the Philadelphia College of Osteopathic Medicine is a graduate college that offers clinicians graduate degrees that are clinically focused, that are driven from collaboration, and also to approach a whole person. So focusing on the whole person using the osteopathic approach. So that's how students get their degrees there. And with each campus, the community is unique and different, right? In Philadelphia, we are really serving an urban community, where in Moultrie, it's more of a suburban community. But then not in Moultrie, in Swanee, there's more of a suburban community. But in Moultrie, it's more rural. And each community has its own fingerprint. So the services may be similar, but how we approach it can be unique too.
Yeah, I would imagine that you're facing different things in each place, mm-hmm. and the students in each of those areas are working within the community to help address those specific needs. What would you say is the greatest value for the students to get involved in their communities this way, or in the community where they are?
I love that it offers the students, one, the opportunity to see patients as people before they see them in the hospital or in the offices, just looking at them with a patient number, right? They see Christy as a sister, as a daughter, as a neighbor, right? They see Flo as a mom. They are seeing people in their natural area, and that's what I love. That's one part. And then it also gives them that hand-on experience before they are actually in the hospital. How do I approach a person and just speak to them, talk to them about blood pressure, have conversations, and hear their concerns, right? So I love that it helps to build that opportunity for community and engagement on both levels.
Yeah, just to be out in the community, I would think, like you said, as opposed to being in the hospital setting. Mm-hmm. That's such a great, sort of training ground for them to know where these people live, what their circumstances are.
Yes.
To see that with their own eyes. Whereas when you're in a medical space, you're not really sure where anybody's from or what their situation is. Mm-hmm. So just to give them that understanding, that's great that they have the opportunity to do that.
to that point, I love that you said to see them where they are, because it helps you have a better understanding of the barriers, right? So if you're in someone's community and you see that there could be violence, or you see, wow, there's only corner stores here, there's no supermarket with fresh food, you have a better understanding of the barriers that they face.
Yes, because you wouldn't know that just speaking to somebody in a medical setting. That's great. I'm so glad that that's a part of what you're doing. And what would you say, let's talk about the topic of wellness when it comes to public health and health equity. I think that's an important thing to touch on here. Can you tell us more about the importance of the conversation around health equity and bringing wellness programs like this to everyone in the community?
Absolutely. This is a spot that I don't want to get on my soapbox because it excites me. It excites me that we are a part of change. So I get so excited about the topic of health equity. I do think that too often it is misunderstood. It is really an opportunity to offer wellness and overall well-being to everyone. And there are times when the vulnerable populations, they don't have a fair chance. So offering them the same services or giving them a little more. I think if people look at it as parenting, you may have one child who excels really quickly in one area, but then you may have a child that's struggling. So then with that child, you give them tutoring. That's all health equity is. Giving the folks that are more vulnerable, who don't have access to certain things, giving them an opportunity to give them access to it. So from a public health standpoint, going out into the community, understanding where there's a need. For example, CWI also, we have 3 healthcare centers at our Philadelphia campus. At each one of our healthcare centers, we have a food pantry. We have frozen foods, frozen meats. We have non-perishable meats because, yes, folks can go to a food pantry within whatever distance and not sure and finding out where that is. But how cool is it to show up at your doctor's office and know that you can get food right then and there at your appointment because you have a food insecurity? Right? So addressing those needs right away and helping folks to have a better understanding that they can obtain a better way of living, that they can obtain overall well-being, that it's not impossible no matter what your circumstances is. So that's what I love about health equity, and that our students and faculty are out there doing that work. It gets me excited.
Yes, and I can see why. And thank you so much for explaining that, because I think that people don't always understand even what health equity means. Right? And you broke that down so lovely. Yeah. I appreciate that. But how fantastic that you're kind of meeting the community need, bringing it to them, the services of, okay, you're going to be here already for a health screening or some sort of medical service. Let's help you while you're here with something we already know you're struggling with.
Yes.
I just think that's fantastic that you've gone to that length to make that possible. And then also I would imagine that it makes the person who's receiving that help and that care feel okay about it. Like they're not having to go seek that support somewhere where they might, feel insecure about it. It's like, you're here and we're taking care of you. So part of taking care of you means we're going to show up and help you get the food you need too.
Yes, absolutely.
That's fantastic.
And there can be times or moments when certain food pantries have it staggered. So you can only come here every 2 weeks and the food is gone within it before they get a chance to go to the food pantry again. So I love that it is something where they can maintain integrity, but also I need it. This is a need right now, and I don't know what to do. Sometimes that happens.
Yeah. And they don't even need to ask. It's like, this is something we're offering. That's wonderful. And that really, speaks to the topics that we talk a lot about on this podcast, community and compassion. I'll get to them in a little bit, but I do think it's just so important that we show up for our community members with compassion and intention in these ways that you're talking about, where you're just showing up and meeting the needs without someone needing to ask to be taken care of and to be helped. So what would you say is the greatest impact you've seen made with this initiative thus far?
Wow. I think one of them is our food pantries. I would say in 2021, and this is rounding off the numbers, We gave out we gave food to close to 200 community members. In 2023, we reached over 4,000 people. So that tells you, one, the need is there and it's increasing. Two, we're happy that we're there to be able to do it, right? Another story that I love from one of our sponsors, we're so happy that we have folks that can sponsor us. We had the opportunity to provide automatic blood pressure cuffs when we did our blood pressure screenings. So if we took your blood pressure and it was like a crazy high number, we asked, did you have a machine at home so you can monitor? If you say no, we gave you a blood pressure cuff. And this one gentleman was so excited. I've been trying to get one from my doctor and going back and forth. And we opened it up and we popped the batteries in. We showed them how to use it. He gave every student a hug. He gave me a hug. I mean, he was so excited. But I love that we're showing folks, hey, this is what your blood pressure is. I'm sure your doctor has already discussed this to you, but now you can be a part of your own care. Check your blood pressure at home. Check it when you're eating certain foods. What's making it go up? So maybe you can think not to eat those foods.
And to have it there right on hand, I know that's a huge deal because otherwise you're having to go to a store or a location that has a blood pressure machine, right?
Absolutely.
And that can be tricky to accomplish. But also to your point, to catch it when it's high and figure out why it's high. I have a family member that was struggling with their blood pressure, and I remember he would say, it's fine. And then it's high. I feel it high, but then by the time I get to the machine, it's gone down. And so like you can't even get an accurate read on what the blood pressure was.
Right.
So that's huge that you're able to give them access to something that they can take home.
I think that's a small thing, but it's exciting.
Yeah.
And it's exciting to see the community's response because, again, it shows us that that's a need. How long was this gentleman walking around needing a blood pressure cuff, trying to manage that on his own? Our senior population is a very vulnerable population, and I love working with our seniors because that's across any economic divide, right? It doesn't matter. If you're a senior, there are certain things you face, fall prevention, losing your sight and losing your vision, and how that can make you move differently, right? That doesn't mean that there's an economic issue, but I feel like that's a vulnerable population that we forget about a lot.
Absolutely. And it's really important that we highlight that need and that we show up to support that area of our community. And that actually was going to be my next question for you because, like I said, we talk a lot about community on this podcast. Can you tell us about the importance of building and strengthening community relationships, especially when it comes to wellness and health?
Absolutely. I think it relates to something I said earlier, right? That public health idea that anything that you're doing in the community, it cannot be about me without me. So one thing that we have with CWI, we have a community advisory committee where we have leaders from the community or community-based organizations. We have some community members. So sometimes you have to have grace, right, when you're having the meetings because they want to tell you about the trash on the block. I was like, I don't know if I can help with that. So we have this community advisory council so that we can get feedback from our community members to have an understanding of what the needs are. We know, and I can say this too, I'm very excited about this. We received a recognition from Healthy People 2030, which is from the Office of Disease and Prevention, to be a Healthy People 2030 champion. So we received that in January, and that just means that the work that we are doing lines up with the work that the Office of Disease and Prevention is doing through Healthy People 2030. And so sometimes we're looking at our own outlines, our guides. We know what we want to know to make to make the communities healthier, but listening to the community lets us have a better understanding of what their needs and what their wants are, and how can we make one thing that we heard, which was something that's really relevant, speaks to technology and the technology divide and how do I use these iPhones or these tablets. And so what we are thinking about doing is having like a technology clinic and have our students participate and show show, this is at one particular senior residential complex, and show them how to navigate technology a little easier, right? So always hearing the voice of the community, listening in is one way to support them. And the other way is to be a partner, right? When they have events, show up. I think sometimes community organizations get that wrong, where they want to put on events and put things out there and they want people to come, but you have to go to their stuff too. You have to be willing to be in their community and be a part of what they need you to be a part of.
That's a great point. Mm-hmm. And you're right. I don't think most organizations think of it that way. We tend to think of it, when you're an organization that's serving the community, that we put on these events to serve the community, and that's all we need to do. But you're right that I would imagine builds a much stronger relationship within the community all the way around. If, community members are putting on events and they want you, especially the students, because you have the students involved. And as you were saying that, I'm thinking, gosh, what another great opportunity for these students to be in a senior center and helping them with the tablets. That's an incredible experience, or an incredible thing to bring those generations together. Absolutely. And for the student to have that experience to take away, is really invaluable, and something that they probably didn't realize they were signing up for in their graduate program.
Absolutely.
And then that now is going to probably stick with them for the rest of their life, right? And so that also really ties into our conversation about compassion. And I think what you're doing is probably planting several seeds of compassion in these students that, like I said, they might not otherwise get in a graduate program, right, which is powerful. Can you tell us what your own definition of compassion is, and then how it relates to the work that you do at the CWI?
Sure. So I'm a Christian. So I do follow a lot of Christian-based values. And one thing for me, compassion, is love and kindness, giving love and kindness without an expectation of reciprocity. And I think that's where people get it wrong. If you're out and you're giving compassion, you can't be upset if someone doesn't receive it the way you think they should. You have to give it and let it flow just because you're supposed to, right? And that flows into the work that we do. So we have some teachable moments. And sometimes we have our staff volunteer also, which is awesome. With our healthcare centers, we have community days where we throw like a party in the neighborhood at the healthcare center. So we have food trucks, we have face painting, all the good things. We're checking and doing screenings. And with our Lancaster site in August, we do a big backpack giveaway. And in October, in our Cambria site in North Philadelphia, we do a big coat giveaway. So there was an instant when, of course, when we're giving out things, there's a limited supply. And there were a couple of ladies who were in North Philadelphia. It's starting to get chilly, and she came up and we didn't have her size. And she just really did have a meltdown. And we have to be more understanding of, we don't know her situation. We don't know how much she was looking forward to this. We can't have a stance that, well, you should have got here early, or, it was free anyway. We have to stand from compassion, right? Compassion makes you operate differently. Yes. It makes you stop and pause and say, I don't know what this woman was going through. Maybe she couldn't get here early. Maybe it took her 2 buses and a trolley to get here. We don't know what the situation is. So I think making sure that compassion rolls into the work that we're doing, when we are doing giveaways, when we are doing blood pressure screenings, when we are just navigating, even with our community-based organizations. And there are times, I'll be honest, because I'm not a saint, right? I have to catch myself when a community-based organization calls and they're like, hey, can you come to our event Saturday? And I'm thinking, there's no way I could get a student Saturday. But I have to pause because maybe they had someone else and it fell through. Right. So my response always is to take a breath and just say, you know what, let me see what I can do. I can't promise you anything because it's the short notice. And they're always understanding, and I think they value that response, and it helps to continue to build our relationships. Yes. So yeah, just acting and operating from a space of not expecting reciprocity.
I love that.
Yeah.
And I also really appreciate that idea of taking a breath because I think we're all really quick to just be annoyed with other people and be very quick to judge, you know, you could see that woman have a meltdown and judge, I can't believe she's acting that way.
Right.
Like you said, this is free anyway. You were late. You know, there's a million ways that we can judge somebody. But if you take a breath and take a moment to think about, I have no clue what she's going through. Or just even how heavy of a burden it is to know, I desperately need that coat.
Right.
And now I'm not going to have it. You know, that it's just, I think, a powerful reminder to all of us to not make such strong assumptions about what anybody's going through and to pause, take a moment and think about, give them grace, give them compassion, and think about what they're carrying and how can my response to them help what they're carrying be a little less heavy.
I love that.
Right?
I love that, right? Don't cancel them.
Yes.
The cancel culture.
Yes.
Right? Don't
like, take
them.
a second to have some compassion. And like I said, I think we're just very quick. We're very quick to judge. We're very quick to point fingers. We're very quick to even just like offload our own stuff onto other people when we don't, you know, realize that we would want someone to have compassion and grace for us.
Absolutely.
If we were in their shoes.
And we forget. We forget when someone did have compassion and grace for us, right? We forget when that was offered to us, and then we turn around and don't give it back. Just pass it on, right?
And we all have been given that. Any person on this planet has been given a moment like that. Absolutely. And you're right. It's very easy to forget. And that's why I love having this conversation. You know, I ask every single guest to talk about compassion, and everybody gives a different perspective, and that's awesome. But it also then always leads to a different type of conversation about it. So thank you for sharing that.
Yeah,
love it.
Thank you.
So lastly, thank you for sharing everything you have about PCOM and the Wellness Initiative. It's really, like I said earlier, powerful to hear how you're giving these graduate students the opportunity to see community in a different way, to see the community that they're serving in a different way, but then maybe just communities in general in a different way. But also that you're giving the community here, you're bringing them into the conversation and you're really meeting them where they're at and trying to deliver services that will help them in the way that they need to be helped, right? Instead of just trying to push things on them where you're like, this will help, this will work, you know?
Absolutely.
So I really appreciate you sharing everything you did with us. And I want to make sure that we point people in the right direction to learn more about CWI and how can they best support your ongoing work or maybe even get involved in the community also.
Absolutely. That would be welcomed for sure. Any search engine, you can go to PCOM CWI and our page will pop up. You can see pictures of all the work that we've done, our annual report. There's an email there, CWI@PCOM.edu. If you want to volunteer, if you want to support through sponsorship, you can do that too. You can reach out to me personally because I do check that email. So that email or my personal email, which is FLORAST@PCOM.edu.
Great.
And we'll be happy to connect.
Wonderful. I will make sure to link those things that you just mentioned in the show notes as well. So it'll be easy for everyone to access.
Wonderful.
And I do encourage everyone to take a look at the website, learn more, get involved, especially if you're here in the Philadelphia area. But then there's also the other satellite sites that people can get involved with. So thank you so much for being here, Flo. It was wonderful chatting with you.
Christy, thank you for having me. It was a wonderful conversation.
My pleasure.